The Territory has a youth suicide rate 3.5 times that of the national average. This week, the Northern Territory Parliament report, Gone Too Soon, listed 23 recommendations to try to lower the high rates of youth suicide here. The Menzies School of Health Research has done its own study looking at 20 cases of self-inflicted deaths of people under 18 years. All but one of the cases involved Indigenous people, and some were children as young as 10. Professor Sven Silburn is one of the researchers, and I spoke to him earlier. Professor Sven Silburn, welcome to the program.
Thank you.
Professor Silburn, you've been involved in an exhaustive study into youth suicide. What stood out for you in that study?
There's been a very big increase between the first half and the second half of the last decade, where rates of suicide in this age group actually doubled. What's concerning about that is that it seems that suicidal behaviour is actually manifesting at an earlier age, and that it's particularly concerning because many very young adolescents really haven't developed the opportunities and the resilience that they need to deal with some of the issues that they're facing.
What is behind this crisis that we're seeing in the Territory?
In any suicide, there are two sets of risks that are at play. They're the long-term cumulative risks that result from early adversity in childhood, where you have high levels of toxic levels of stress. You also have issues of undernutrition, and these are very important to the developing brain.
So it's the exposure to violence at such a young age, or trauma at such a young age, that is contributing to a decision to take one's life?
It's one of the factors that renders you vulnerable. It's where there are very high levels of exposure to stress, and where that happens over a long period of time, you get these very adverse effects that increase risks for mental health problems, drug and alcohol use, and also impulsive acting out behaviour.
And what groups are particularly at risk?
For the older age group, you clearly see the role of drugs and alcohol, particularly that almost all of those suicides were associated with intoxication at the time of death. For the younger age group, drugs and alcohol are not a standout cause, and for many these appear to come out of the blue. When you look into them more closely, you can see that many of these early life factors are very important, particularly exposure, whether or not they've been in contact with the child protection system. That's a marker for things that are happening. The other thing that stood out is that a high proportion of the children under 17 who took their lives were either not attending school or were attending school very irregularly. And I think that what that emphasises is that school is very important as a protective factor in children's life.
The Northern Territory Parliament's Gone Too Soon report has listed 23 recommendations to try and ease this problem. What is the most immediate priority, you would say?
The most immediate priority is to get a coordinated set of actions, and I think that's their final recommendation. I particularly think it's important that the youth development and community development positions that are advertised or that are being promoted, that those be filled or developed soon.
The report recommends that the Territory lobby for more services in regional areas like Katherine and Tennant Creek. How badly are they needed?
There's no secret in that the range of services that are available are way below what's required and what's present in most other jurisdictions. There's a lot of catch-up to be done. But in the meantime, we have to work with the people we've got on the ground and give them the best supports so that they can manage when they're faced with a situation.
Is there just too many people slipping through the gaps? Have they been picked up from child protection in the first instance and slipped through the gaps?
It's clear that has happened too often. And I think that what this report and the action plan that results from this report is about closing those gaps. The other particular gap that needs to be closed is that there's a plethora of youth support services and youth activities funded through multiple funding sources. And tragically, there are very few of those that last. And there's got to be a more sustained way of funding and supporting them so that you build capacity in community that stays there and it doesn't end when the funding stops. this approach where you have projects funded for just 12 months or 24 months is killing people in communities. We can do better.
Professor Silburn, thanks so much for talking with us.
Thank you.